40 years old male, resident of Agusan del Sur and work as a farmer. He's complaining of fever, myalgia, malaise, and lethargy. And her daughter said, "Ay, murag pareho mo aning gibati sa TikTok, tanawa." So the daughter played the TikTok videos.
What are the signs and symptoms of schistosomiasis? After being infected, cercaria penetration on the skin may lead to rash or itching that are localized but may resolve within days. This is what we call swimmer's itch. Typically, after 2 to 12 weeks following the cercaria penetration, schistosomites migration can give rise to syndrome characterized by fatigability, respiratory symptoms, arthralgia, myalgia, malaise, eosinophilia, fever, and abdominal pain, which is also called as Katayama syndrome. Hepatosplenomegaly is not uncommon and will result to weakness at this point of infection. In some rare cases, it may lead to severe hepatic dysfunction or even death. Always remember that symptoms of schistosomiasis is the body's reaction towards the eggs that are produced by the worms, not from the worms themselves.
Pathology and chronic disease manifestations of Schistosomiasis japonicum are due to the host granulomatous reaction to eggs deposited in liver and other organs. Hepatosplenic disease is the most serious consequence of chronic schistosomiasis. It is characterized by hepatosplenomegaly, portal hypertension, ascites, and development of collateral circulation. Cor pulmonale can result from obstruction of the pulmonary vasculature due to granuloma formation and fibrosis. Eggs likely reach the pulmonary circulation via the portosystemic collateral circulation, where eggs are shunted into the system and filtered in the pulmonary microvasculature, eventually causing pulmonary hypertension.
Schistosoma life cycle. So here you can see an infected individual which sheds the eggs of the schistosoma through his feces or through his urine. So the diagnostic stage is the egg. The egg then hatches and releases the miracidia in the water. So in the water, you will see the presence of the intermediate host, which are the snails. Thus, in the snails, the sporocyst develops and also its successive generation. Thus, the pre-swimming cercariae, which are the infective stage, are now being released from the snail into the water. So, when an individual goes in the water, the cercariae then penetrates its skin. Then the cercariae loses its tail during penetration and becomes a schistosomule. The schistosomule then goes to the circulation and then migrates to the portal blood in the liver, and then matures into the adult form. So the adult form then are being paired and then migrates to the mesenteric venules and the venous plexus of the bladder. So here the eggs are being laid and then they circulate the liver and shed in the stools, while in the venous plexus of the bladder the eggs are now being shed in the urine. And then the life cycle goes on.
The signs and symptoms, pathophysiology, and life cycle of Schistosoma japonicum, Mr. Antonito asked his daughter for more information with regards to the diagnosis and medication. So the daughter, once again, played the TikTok videos for diagnosis and treatment.
A second-year med student, and today we're going to talk about
diagnosis schistosomiasis.
Infections when there is scarring or fibrosis of sites of ulcerations. Stool examinations can give negative results even in active infection. Schistosome eggs can also be recovered by biopsy. However, these require specialized equipment and are not practical for mass screening. Microscopic examination techniques are the most specific since these directly visualize the parasite egg. MIFC is used in moderate and heavy infections of greater than 10 eggs per gram of feces. Catocat's technique considered the most suitable for quantification of eggs. Rectal snips and imprints are the most sensitive but most invasive. I will also flash some immunodiagnostic tests that could diagnose schistosoma. That's all! Till next time!
Get your hands up, or I'll punch you in the stop your staring at my face. Take a hit, take a
After watching the TikTok videos, Mr. Antonito made a promise to his daughter that he will go to see a doctor on the next day. And that will be all. Thank you.